Hi, my name is Lydia Pitcher, and for my implicit bias video, I got overweight and obesity. Implicit bias involves hidden stereotypes and attitudes that we develop over time, usually about certain groups of people related to things like age, gender, ability, religion, or sexual orientation, or weight. While most most biases are unconscious, they're more deep-rooted and developed throughout a person's life. They're typically formed through things like background, personal experience, and revolving social stereotypes that we don't really recognize that we're developing, but they're still developed. In healthcare, the topic of weight has been a very negative assumption among healthcare providers. For years, it's been seen that obesity or overweight people are associated with like laziness or lack of willpower, self-control, or deem the person as like non-compliant. And then there's also a flip side to things like skinny people, where they're seen as unhealthy still and like anorexic or malnourished. But there's also a side of it where they're also seen as a goal weight, or healthcare providers don't really see them as unhealthy because they see they're at a healthy weight and there's no concerns, while there's usually concerns about it. The three biases associated with overweight people are: one, laziness. When healthcare providers assume that you're just lazy because you're not really losing weight, even though you're doing all the things, I think you're just kind of lying and that you're not doing the things to lose weight. But most people have emotional or physical barriers that control your weight more than how motivated you are or how lazy or motivated you are. Another one is also motivation and lack of willpower. Healthcare providers automatically think, since you can't lose weight or you're overweight, that you don't really have the willpower to stick to a health plan like diet and exercise. And they don't really let the patient talk first, kind of voicing their concerns about what they've already done or what they've tried doing, or like kind of physical or mental barriers such as depression, anxiety. You can't get out and go to the gym because you have depression, so you can't lose weight, or you don't have the resources to access like healthy food or anything, or you don't know how to meal plan or anything. They just kind of jump to conclusions saying that you're just unmotivated, and since you can't lose weight, you're just not sticking to your plan. And then they also see you as non-compliant. They assume since you're overweight that you're just not doing the diet and exercise, or if you go in and you get like a treatment plan for diet and exercise. While this may be true for some people just don't do it and they don't really care about their weight. Most people usually stick to the plan and they just get really discouraged after 5-6 weeks of not seeing any results, not seeing any difference in their weight or change in their weight. And they don't really understand that there's not a simple fix to just weight loss in general. There's usually underlying conditions like genetic components or hormonal components to it. But healthcare providers usually just say, you didn't do diet and exercise, so you're non-compliant. You go to the doctor and you have a specific concern not revolving weight, and typically if you are overweight, doctors just kind of associate this issue is because you're overweight. They don't really look at anything further, versus if you are a normal, healthy weight person, they'll typically look into more what this problem is. So say you have, a bad knee. For an overweight person, they'll just say it's because of your weight, but for a normal, healthy weight person, they'll typically look into it more. And this is really damaging to a person's aspect of mental health and just kind of how they look at healthcare in general, because they go into the doctor and all they say is you just need to lose weight, and it's not typically that simple of a fix. There's a few strategies to combat implicit bias, including mindfulness, individualization, perceptive talking, and learning to slow down. Mindfulness is extremely important to learn how to reduce stress and anxiety overall, reduce physical and mental exhaustion, which allows nurses to provide care without potentially risking their own mental and physical health. For a nurse, it's really important to be mindful and learn the mindfulness techniques because you're in a lot of really highly stressful situations where your patient needs to come first and they need your complete mind and everything there. A few things you can do for mindfulness include things like meditation, appropriate sleep, exercise, and being attentive to when your body just kind of needs an overall break. Slowing down is another one. Learning to slow down and think of the person as the person first instinctively, instead of kind of thinking as the person as the attached bias or a specific group attached to it. When you think about the patient, you still have the underlying bias that you're kind of given, but when you learn how to slow down and kind of just think about just the patient first, those will slowly kind of start to go away. Some things you can do are think about like positive interactions that you've had, like with say for mine, overweight people. Think of like a positive interaction that you've had with an overweight person instead of just kind of jumping to the conclusion that, oh, they're overweight, they're not healthy, things like that. And then individualization, evaluating people based off their personal characteristics instead of kind of their affiliated group, kind of who they are as a person instead of just this overweight person. This will help you learn kind of who the patient is, what they need, have them open up and discuss difficult topics, especially regarding weight. That is important and kind of usually what the patient needs from you, not necessarily as a nurse what to do for obesity or overweight. They just need you to listen to them. And then perceptive talking, we learn kind of how to set all of our thoughts, our own feelings aside, and pick up on what the patient needs instead of, you're quick to just kind of go with your own implicit bias. Just listening to their own concerns and emotions and learn how to have empathy for any emotion that they could have or any thoughts that they could have and controlling them and letting them be heard and seen and just putting away your own feelings. Thank you.